Now move ahead to our next topic, that is pathophysiology of swelling in lymphatic disorders. Okay, so to manage swelling correctly, you need to understand why fluid accumulates in different conditions. Okay, although all present as swelling, okay, the underlying mechanisms differ significantly. Okay, which directly affects treatment strategy. So you should know that. Okay, so first point we will discuss in the pathophysiology of swelling in lymphatic disorders is post-surgical edema. In this pathophysiology we will look about what is the mechanism for post-surgical edema. Okay, so post-surgical edema results from a combination of tissue trauma, second inflammatory response, thirdly lymphatic disruption. Okay, so how tissue trauma? Their surgical incision happens and it damages to blood vessels and tissues. Okay, that leads to increased capillary permeability. Thirdly, plasma proteins and fluid leak into interstitial space. Okay, second point in mechanism is inflammatory response. Okay, release of mediators like histamine and prostaglandins. Okay, release of mediators like histamine or prostaglandins. Okay, causes are vasodilation and second is increased fluid leakage. Okay, and the third is lymphatic disruption. So how lymphatic disruption occurs? Lymphatic vessels may be cut or removed like lymph node dissection. Okay, that's why reduces lymphatic transport capacity. Okay, so next is net effect. First we have discussed about post-surgical edema. Okay, here we have discussed about mechanism. Second we will discuss about net effect under the heading of post-surgical edema. So here increased fluid production plus reduced drainage results in accumulation of protein rich fluid. Okay, so next we will look out the clinical features of post-surgical edema. Okay, first is localized swelling around surgical sites. Second is soft, often pitting in early phase. Third is associated with pain, warmth and limited mobility. Okay, now we will look out clinical insights of post-surgical edema. Okay, if lymph nodes are removed like breast cancer surgery, okay, this may progress to secondary lymphedema. Okay, this is all about post-surgical edema. Now we will look out inflammatory swelling. Okay, the mechanism is, this is the part of the body's natural healing response. Okay, key processes are, first is vasodilation. Here increased blood flow causes redness and heat. Okay, secondly, increased capillary permeability results in endothelial gaps widen. Okay, how increased capillary permeability? Firstly, endothelial gaps widen. Secondly, fluid plus proteins plus immune cells enter tissues. Okay, third is cellular response. Here migration of neutrophils and macrophages occurs. Okay, second we will discuss about net effect of inflammatory swelling. Rapid accumulation of fluid plus inflammatory exudate. Okay, rapid accumulation of fluid is the net effect of inflammatory swelling plus inflammatory exudate. Okay, so characteristics of fluid, here is protein rich. First characteristics of inflammatory swelling is protein rich. Secondly, contains immune cells, cytokines and debris. Okay, What it contains? Immune cells, cytokines and debris. Okay. What are the clinical features? First is swelling plus redness plus heat plus pain. Okay, that is cardinal signs of inflammation. Okay. Second is usually acute and temporary. Third is improves as healing progresses. Okay. So what is the role of lymphatic system? First is removes excess fluid. Second is clears inflammatory mediators. Okay. If overwhelmed, swelling persists longer. Okay. So third we will discuss about lymphatic obstruction. So the mechanism of lymphatic obstruction is occurs when lymph flow is physically blocked or impaired. Okay. What are the causes? Causes may include first is tumors compressing lymph vessels. Second is fibrosis, means post radiation. Third is surgical removal of lymph nodes. Fourth is parasitic infection, for example filariasis. Okay. These are the causes of lymphatic obstruction. Okay. So what is the pathophysiological changes? First is reduced transport capacity. Here lymph cannot move effectively. Okay. Second is protein accumulation. Here proteins remain in interstitial space and attract more fluid, or that is osmotic effect. Okay. Third physiological changes is chronic inflammation. Okay. Here persistent immune activation occurs. Okay. Fourth changes fibrosis development. Here tissues becomes thick, hard and non-elastic. Okay. So what is the net effect of lymphatic obstruction? Chronic progressive swelling occurs. Okay, like you can say that lymphedema. Okay, chronic and progressive swelling. Okay, and what are the clinical features? First is initially soft, later non-pitting. Okay, what skin changes occurs here? Thickening and fibrosis. Okay, and heaviness and reduced mobility is also a clinical feature. Okay, and increased infection risk. Okay, so what are the key differences, like clinical comparison of these three features? So first is post-surgical edema. The feature is onset. Onset of post-surgical edema is after surgery. Okay, and inflammatory swelling onset is acute injury or infection, and lymphatic obstruction onset is gradual or post event. Okay, so what are the cause of post-surgical edema? Cause is trauma plus lymph damage, and the cause for inflammatory swelling is inflammatory response, and the cause for lymphatic obstruction is blocked lymph flow. Okay, so what is the duration for post-surgical edema? Duration is short to medium, and duration for inflammatory swelling is short and resolves. It resolves. Okay, because its duration is short. Okay, so lymphatic obstruction duration is chronic. Okay, so fluid type for post-surgical edema is protein rich, and for inflammatory swelling is protein rich also, and for lymphatic obstruction fluid type is high protein rich. Okay, and the reversibility for post-surgical edema is often reversible. Okay, but in inflammatory swelling is fully reversible, and in lymphatic obstruction it is progressive if untreated. Okay, so clinical relevance for manual lymphatic drainage post-surgical edema. Firstly, MLD helps restore drainage. Secondly, prevents progression to lymphedema. It's a clinical relevance regarding post-surgical edema for MLD. Okay, and inflammatory swelling, here use cautiously. Okay, you should be take it cautiously. Okay, avoid in acute infection. Okay, and in lymphatic obstruction the clinical relevance for MLD is, first is primary indication for MLD, second is requires long-term management. Okay, so not all swelling should be treated the same way. Okay, you should know that correct identification of pathophysiology is equal to correct treatment. Okay, so What you have learned in this topic, you should know the summary of this topic, that post-surgical edema and inflammatory swelling are typically acute responses, okay, involving increased fluid formation, whereas lymphatic obstruction represents a chronic failure of lymph transport, okay. Understanding these mechanisms is essential for accurate diagnosis and effective clinical management using techniques like MLD. Okay, so let's move to our next topic. So our next topic is indications for manual lymphatic drainage. Okay, MLD is indicated where there is accumulation of interstitial fluid, okay, impaired lymphatic transport, or a need to enhance tissue recovery. Okay, the following are key clinical indications relevant to your course. You should listen it carefully, okay? So, first we will discuss about post-mastectomy, breast surgery related lymphedema, okay? So, the clinical background is firstly common after breast cancer surgery, especially with first auxiliary lymph node dissection, and second is radiation therapy, okay. These interventions damage or remove lymphatic pathways, reducing drainage capacity of the upper limb, okay. Now we will discuss about the pathophysiology, okay. Firstly, impaired lymph transport, that accumulation of protein rich fluid, okay. Impaired lymph transport causes accumulation of protein rich fluid. Secondly, chronic inflammation causes fibrosis if untreated, okay. So what is the clinical presentation? First is swelling in arm, breast or chest wall, okay. Second is heaviness and tightness. Third is reduced range of motion, and fourth is risk of recurrent infections like cellulitis, okay. So what is the role of manual lymphatic drainage here? First of all is redirects lymph to alternative pathways, okay. Secondly, enhances drainage toward intact lymph nodes. Third is reduces swelling and discomfort. Fourth is prevents progression to chronic lymphedema, okay. So clinical importance, this is one of the most important and evidence based indications for MLD, okay. So second we will discuss about orthopedic swelling. So the clinical background for orthopedic swelling is occurs after firstly fractures, secondly joint injuries, for example ankle sprain, thirdly post-operative orthopedic procedures, for example ACL repair and joint replacement, okay. So pathophysiology, firstly trauma causes inflammation, inflammation causes increased capillary permeability, okay. Secondly, excess interstitial fluid accumulation. Thirdly, temporary overload of lymphatic system. So the clinical presentation, firstly is localized swelling, secondly pain and stiffness, third is reduced joint mobility. So the role of MLD, so what is the role of MLD here? Firstly, accelerates removal of excess fluid. Secondly, it reduces tissue pressure. Thirdly, improves range of motion. And fourth role is enhances recovery time, okay. So what is the clinical insight? MLD is especially useful in subacute phase, not immediately in acute inflammation, okay. So next we will look out the sports injuries. the third indication of manual lymphatic drainage. First, we have discussed about post-mastectomy. Then we have discussed about orthopedic swelling. Now we will discuss about sports injuries. Okay, it's also an indication of MLD. Okay, so clinical background for sports injuries: common in muscle strain, second ligament sprains, third is contusions. Okay, so pathophysiology: first is microtrauma, causes inflammatory response. Okay, second is fluid and inflammatory mediators accumulate. Okay, so next is clinical presentation. First is swelling, second is pain, third is reduced performance, fourth is muscle tightness. Okay, so what is the role of MLD here? Firstly, it clears inflammatory exudate. Secondly, reduces swelling and discomfort. Third, speeds up recovery. Okay, and fourth is helps athletes return to activity faster. Okay, so what is the clinical integration? Often combined with firstly cryotherapy, secondly compression, and third is exercise rehabilitation. Okay, so next indication is cosmetic or facial lymphatic drainage. Okay, so the clinical background is it's used in firstly facial puffiness, secondly post cosmetic procedures, for example fillers and liposuction. Okay, third is skin rejuvenation protocols. Okay, skin rejuvenation protocols. These three are the clinical backgrounds for cosmetic or facial lymphatic drainage. Okay, next we will look out pathophysiology of it. First is fluid retention in superficial tissues, second is mild lymphatic stagnation. Okay, next is clinical presentation. Firstly facial swelling, second is dull skin appearance, third is periorbital puffiness. Okay, so what is the role of MLD here? Firstly, it improves lymphatic circulation in superficial tissues. Secondly, it reduces puffiness. Thirdly, it enhances skin tone and appearance. And fourth is promotes detoxification. Okay, next is special consideration. Here you have to do your consideration here. Firstly, requires very gentle and precise technique. Okay, secondly, focus on cervical lymph node drainage. Okay, these are the special considerations regarding cosmetic or facial lymphatic drainage. Okay, so what are the key clinical principles across all indications? MLD is effective when swelling is related to lymphatic overload or dysfunction. Okay, second is there is no contraindication, for example acute infection, cardiac failure. Okay, acute infection and cardiac failure. Okay, if these are not the contraindication, then MLD is effective. Okay, so let's we summarize the indications. So first indication we have discussed about post-mastectomy, second is orthopedic swelling, third is post injuries, and fourth is cosmetic or facial. Okay, so what are the causes for post-mastectomy? Lymph node removal, this is the cause of post-mastectomy. And what is the cause for orthopedic swelling? It's injury or surgery. Okay, So what is the cause for sports injuries? It's inflammation, okay. And what is the cause for cosmetic or facial? It's fluid retention, okay. So what is the cause for role of MLD? What is the role of MLD for post-mastectomy? Redirect lymph and prevent lymphedema. This is the role of MLD for the indication post-mastectomy, okay. Next indication, orthopedic swelling. For that, the role of MLD is reduce edema and improve mobility, okay. This is the role of MLD for orthopedic swelling, okay. So what is the role of MLD for sports injuries? It's speed recovery and reduce swelling, okay. This is the role of MLD for sports injuries, okay. So what is the role of MLD for cosmetic or facial? It's improve appearance and reduce puffiness. It's the role of MLD for cosmetic and facial, okay. So you should know the most important key point, that is MLD is not just for lymphedema, okay. It is a versatile tool used across rehabilitation, sports and aesthetics, okay. So let's move to our next topic regarding contraindications. We have discussed about indications, now we will discuss about contraindications, okay. So our next topic is contraindications and precautions in manual lymphatic drainage, MLD, okay. Absolute, we will discuss about absolute versus relative, okay. So this is a high risk decision area, okay. This is a high risk decision area, okay. Applying MLD in the wrong context can worsen pathology or create systematic complications, okay. Always screen before treatment, otherwise the treatment goes wrong, okay. So firstly we will discuss about absolute contraindications that do not perform MLD, okay. These are conditions where MLD can directly endanger the patient. First condition is acute infection, for example cellulitis or erysipelas, okay. So why contraindicated? MLD increases lymph flow that can spread pathogens systematically. Secondly, risk of sepsis, okay. So clinical signs for this is, first is redness, warmth, swelling. Secondly, fever, malaise. Thirdly, local tenderness, okay. So what action should be required? Defer MLD, okay. Refer for medical treatment like antibiotics, okay. Next is acute deep vein thrombosis, that is absolute contraindication, DVT. So why contraindicated? Manual stimulation may dislodge a thrombus that causes risk of pulmonary embolism, okay. That is the risk for pulmonary embolism, okay. So what are the clinical signs? First is calf pain, swelling. Second is warmth, redness. And third is positive clinical suspicion or history, okay. This is the clinical signs for acute deep vein thrombosis, DVT, okay. So what should be the action required? Firstly, strictly avoid MLD. Secondly, immediate medical referral, okay. So next is decompensated cardiac failure if uncontrolled. So why contraindicated? MLD increases venous return that overloads the heart, okay. That can worsen pulmonary edema, okay. So the clinical signs, severe dyspnea, fatigue, okay, bilateral edema, orthopnea, okay. So what action should be required? No MLD until medically stabilized, okay. So next is active malignancy, if it is untreated or unstable, okay. So why contraindicated? Theoretical risk of facilitating tumor cells, spread via lymphatics, okay. So the clinical approach requires oncologist clearance before considering MLD, okay. Second is relative contraindications. Use with caution or modify technique, okay. MLD may be performed only with clinical judgment, okay, modification or medical clearance, okay. Firstly, we will discuss about controlled cardiac conditions that are relative contraindications to, okay. Concern is increased fluid return may still strain cardiac function, okay. So the approach is firstly use short and gentle sessions. Secondly, monitor symptoms like breathlessness and fatigue, okay. Second relative contraindication is renal insufficiency. So the concern is increased fluid mobilization due to kidney overload, okay. Increased fluid mobilization can make kidney overload, okay. Approach is proceed cautiously, okay. Secondly, ensure medical clearance. Thirdly, monitor fluid tolerance, okay. Third is malignancy, if it treated or stable, okay. Then the concern is depends on stage and medical status, okay. So the approach is MLD may be used in oncology rehab, okay. For example, post-mastectomy, okay. Always follow oncology guidelines, okay. This is the second approach for malignancy if it's treated or stable, okay. So next is thyroid disorders like neck treatment area. Concern is stimulation over thyroid may affect gland activity, that is theoretical, okay. It's a concern. So approach is firstly avoid direct pressure over thyroid. Secondly, modify cervical techniques, okay. This is the approach. So next is pregnancy. The concern is hormonal and circulatory changes occurs here, okay. Concern is hormonal and circulatory changes, okay. So the approach is generally safe with modifications, okay. Secondly, avoid deep abdominal work. Thirdly, use gentle techniques, okay. Next is bronchial asthma. The concern is increased lymph return may transiently affect respiratory status, okay. So the approach is firstly monitor breathing. Secondly, avoid aggressive thoracic techniques, okay. So next we will discuss about precautions like general safety considerations, okay. Even when not contraindicated, apply these safeguards, okay. First is pressure control. Here MLD must be light and superficial. Secondly, deep pressure can collapse lymph capillaries and worsen stagnation, okay. Second is direction and technique. Here always follow anatomical drainage pathways, okay. Secondly, incorrect direction is equal to ineffective or harmful, okay. So next is skin integrity. Avoid areas with open wounds, Secondly, burns. Thirdly, active infections. Okay. Next is patient monitoring. Here you should watch for dizziness. Secondly, shortness of breath. Thirdly, pain increase. Okay, so stop immediately if symptoms appear. Okay. Next is clinical decision rule. Before always ask first, is there infection? If yes, no MLD. Okay. Secondly, is there risk of embolism, DVT? No MLD. Okay. Third is the heart stable? If no, no MLD. Okay. Fourth is the condition medically cleared? If unsure, refer to check medically if the condition is cleared or not. Okay. Then you are clear about that, then you have to go with MLD, otherwise you have to refer to the physician to be clear about the medical condition. Okay. So the summary for this topic, you should know that what you have studied in this topic. So categories are absolute, relative and precautions. So in absolute, the condition is infection, DVT, cardiac failure, active malignancy. Okay. And for relative, the condition is controlled cardiac or renal. Okay. Pregnancy, treated cancer. Okay. These are the conditions for relative. Okay. So what are the precautions for these conditions? That's skin, pressure and technique. These three are the precautions. Okay. So what actions should be required for absolute? For absolute, do not treat. Okay. No MLD. And for relative, modify and monitor regarding MLD. Okay. And for precautions, if you can look after, you go with precautions, then action is adjust safely. Okay. So what is the key point for this? Safety comes before technique. Okay. A correct MLD technique applied in a contraindicated patient is still wrong treatment. Okay. You should know about the indications, contraindications and precautions. Okay. So absolute contraindications prohibit the use of MLD due to serious systemic risk. Okay. While relative contraindications require careful clinical judgment and modification. Okay. Proper screening and precautionary measures are essential to ensure safe and effective therapy. Okay. You should know about the indications and contraindications and precautions carefully and consciously. You have to plan the treatment, otherwise the treatment goes wrong and the condition of the patient will be worsened. You should be careful about all these situations. Okay. So these are the contraindications that we have discussed about. Okay. So next we will move to our next topic. Now next topic is core principles of manual lymphatic drainage, MLD. These three principles determine whether MLD is effective or counterproductive. Okay. Technique without these fundamentals leads to poor outcomes. Okay. So first is pressure. That is very light and superficial. Okay. We will discuss about its physiological basis. Okay. Firstly, lymphatic capillaries are located just beneath the skin, that is superficial fascia. Okay. Secondly, they are highly delicate and collapsible. Okay. Next is why light pressure is essential. Firstly, gentle stretching of the skin. that opens lymphatic microvalves. Secondly, this facilitates lymph uptake. Okay, next, deep pressure. First, it collapses lymph capillaries. Secondly, blocks lymph entry and pushes fluid deeper into tissues. That is undesirable. Okay, deep pressure basically collapses lymph capillaries and blocks lymph entry and pushes fluid deeper into tissues. Okay, and the gentle stretching of the skin can open lymphatic microvalves and facilitates lymph uptake. This is the answer regarding why light pressure is essential. Okay, next is correct pressure characteristics. Okay, firstly, light skin stretching, not muscle. Okay, not muscle compression. Okay, there is light skin stretching. Okay, not muscle compression. Okay, secondly, no pain or discomfort. Okay, thirdly, comparable to moving the skin, not pressing into it. Okay, next is clinical mistake to avoid. So treating MLD like deep massage. Don't treat MLD like deep massage. Okay, second is the mistake that you have to avoid and you have to follow the exact pattern is MLD is a neurovascular, not muscular technique. Okay, you should know that MLD is not a muscular technique, is a neurovascular. You have to not do the deep massage. Okay, you should do the superficial massage. Okay, next is direction, proximal clearance first. Okay, first we will look out physiological basis. Firstly, in physiological basis, lymph flows towards central lymph nodes. Okay, for example, axillary and inguinal. Okay, secondly, flow is unidirectional. Okay, this is physiological basis. Next is principal explanation. Before draining fluid from a distal area, for example, hand or foot, you must first clear proximal pathways. Okay, for example, axilla and groin. Okay, so next is why this is critical. If proximal pathways are congested, distal drainage has nowhere to go. Okay, firstly you have to clear the proximal pathway. Okay, secondly, clearing central areas creates a pressure gradient. Okay, allows fluid to move effectively. Okay, that's why you have to make sure that the proximal pathway is clear. Okay, next is practical example for upper limb. Okay, first is start at auxiliary lymph nodes, secondly then move to upper arm, then forearm, and then hand. Okay, this is a practical example for upper limb. Okay, so next is clinical mistake to avoid. What clinical mistake you have to avoid? Starting directly at swollen area, avoid it. You don't have to start directly at the swollen area, it may cause harm. Okay, always clear central, then move peripheral. Okay, you have to start from central, always clear central, then move peripheral. Okay, next we will look out rhythm and repetition, its physiological basis. Okay, firstly, lymphangions contract in a slow rhythmic manner. Okay, lymphangions contraction is what is in the way in a slow and rhythmic manner. Okay, MLD mimics this natural rhythm. Okay, MLD mimics this natural rhythm. Okay, so next is correct technique features. Slow, consistent and repetitive strokes. Each movement has working phase, that is gentle stretch. Okay, next is relaxation phase, that is release. Okay, each movement has working phase and relaxation phase. Working phase is gentle stretch and the relaxation phase is release. Okay, stretch, release, stretch, release, gentle stretch, release, working phase and then relaxation phase. Okay, slow, consistent, repetitive strokes. Okay, this is the correct technique features. Okay, so why rhythm matters? Firstly, stimulates intrinsic lymphatic contractions. Secondly, enhances flow efficiency. Thirdly, promotes parasympathetic relaxation response. Okay, these are the 3 points that can convince you that why rhythm matters. First is stimulates intrinsic lymphatic contractions. Okay, then is enhances lymph flow, enhances flow efficiency. Okay, third is promotes parasympathetic relaxation response. Okay, so next is recommended pattern. What is the recommended pattern? Repetition is approximately 5 to 7 times per area. Okay, per area repetition is 5 to 7 approximately. This is the repetition. Okay, and speed should be slow and controlled, not rushed. Okay, next is clinical effects. Firstly, improved limb propulsion. Secondly, reduced swelling. Thirdly, relaxation and pain relief. These 3 are the clinical effects. Okay, improved lymph propulsion, reduced swelling and relaxation and pain relief. Okay, next is integration of all 3 principles. Okay, effective MLD is equal to combination of light pressure, correct direction and rhythm and repetition. Okay, firstly light pressure, that is make the walls open. Okay, secondly correct direction, that ensures proper flow. Okay, thirdly rhythm and repetition, that maintains movement. Okay, if one is missing, treatment becomes ineffective. So you have to know the 3 principles and the exact way. Okay, so what common clinical errors are? Deep pressure. First error is deep pressure. Second is fast rushed movements. Third is incorrect direction. And fourth is skipping proximal clearance. These 4 are the common clinical errors. You should be familiar about that. Okay, so what is the key point regarding this topic? MLD is not about force, it's not about deep massage, it is about precision, direction and control. You should know the exact control, exact direction, exact the way you have to perform the lymphatic drainage. Okay, it's not a deep massage, it's not a deep force, it's not about force. Okay, it's a light work. Okay, so the summary regarding this topic: the core principles of MLD: light superficial pressure, proximal to distal sequencing and slow rhythmic repetition are essential for stimulating lymph flows safely and effectively. Okay, mastery of these principles ensures optimal clinical outcomes and prevents harm. Okay, this is the topic. So let's move ahead to our next topic regarding our next topic is introduction to MLD techniques, theoretical explanation. Okay, first we will look about the theoretical explanation regarding MLD techniques. Okay, so these foundational strokes are designed to gently stretch the skin into a specific direction to facilitate lymph uptake and propulsion. All techniques must follow the core principles: light pressure, correct direction, slow rhythm and repetition. Okay, so first technique is stationary circles. So what is the concept regarding stationary circles? So a circular rhythmic skin stretching technique. Okay, where the therapist's hand remains in contact with the skin while creating small circular movements. Okay, hand position, use flat fingers or palmar surface. Okay, hand remains relaxed and fully in contact with the skin. Okay, movement phases, each circle has two phases. First is working phase, second is relaxation phase. In working phase, gentle stretch of the skin in a circular direction. Secondly, movement is slow and controlled. Third, pressure is applied superficially. Okay, this is the working phase. Okay, that circular direction, slow and controlled movement, and superficially pressure applied. Okay, so relaxation phase, here pressure is released, skin returns to resting position and no backward drag on the skin. Okay, this is the relaxation phase. Okay, so direction, always directed toward the nearest lymph node group. Okay, follows anatomical drainage pathways. Okay, you should know what is the anatomical drainage pathway. Okay, always direct toward the nearest lymph node group. Okay, so clinical use, most commonly used technique. Okay, this is the most commonly used technique. Okay, suitable for neck, face and trunk. Okay, general lymph node stimulation as well. Okay, these are the clinical use of this technique. So the key point for this technique is movement comes from skin stretching. Okay, not sliding over the skin. Okay, so second technique is pump technique. So what is the concept of this pump technique? A rhythmic pumping motion primarily used on limbs. Okay, mimicking the natural pumping action of the lymph vessels. Okay, hand position of this pump technique, use palmar surface of the hand, fingers relaxed, slightly curved around the limb. Okay, movement phases, same as that of previous, working phase and relaxation phase. In working phase, gentle pressure applied in a direction toward proximal lymph nodes. Skin is stretched slightly forward. Okay, in relaxation phase, pressure is released, hand returns passively without dragging the skin. Okay, these are the two movement phases of both techniques. Okay, so the direction, always distal to proximal after proximal clearance. Okay, you should be active regarding this, that you have to firstly clear the proximal part as well, then you have to go with the distal to proximal. Okay, for example, forearm, upper arm and then axilla. Okay, this is the sequence of this is the direction for this pump technique. Okay, so clinical use, this technique used in upper limb, second lower limb and areas with elongated anatomy. Okay, this is the clinical use. Here this pump technique is used. Okay, so key point, motion resembles a soft pumping action, not squeezing or pressing deeply. Okay, soft pumping action. Okay, not squeezing or pressing. Okay, so next is scoop technique. Scoop, it's not the ice cream scoop, it's the word that of ice cream scoop as well, same as that of ice cream scoop. Okay, but you have to make the shape of your fingers like a scoop. Okay, so what is the concept regarding this scoop technique? A scooping or lifting movement used to direct lymph flow along curved body surfaces. Okay, so hand position in this scoop technique is, first you should have the concept that the scooping or a lifting movement used here, okay, to direct lymph flow along curved body surfaces. This scoop technique is used for curved body surfaces, okay. So hand position, hand placed along the limb or body contour, okay. Fingers slightly flexed to create a scoop shape, okay. So movement phase, working phase and relaxation phase. Here working phase, gentle scooping motion, lift plus stretch skin, okay. Secondly, move in direction of lymph flow, okay. Second is relaxation phase. Here release pressure smoothly and then return without friction, okay. So direction, directed toward regional lymph nodes, okay. Follows anatomical pathways, okay. Direction is directed toward regional lymph nodes and follows the anatomical pathways, okay. So clinical use, used in limbs especially thigh and calf, okay. Lateral trunk and areas requiring curved motion, okay. So key point regarding this scoop technique, regarding this, you have to think of lifting and guiding fluid, not pushing it forcefully, okay. MLD is all about superficial and light pressure, okay, not deep massage or pushing or forcing, okay. So common features of all techniques, you should know that pressure, movement, rhythm, direction and phases, these are the 5 features of all techniques, okay. So you should know about pressure should be very light and superficial, okay. Movement should be skin stretch, not sliding, okay. Rhythm slow and repetitive, okay. Direction should be toward lymph nodes and phases should be working plus relaxation phase, okay. These two are the phases, working plus relaxation, okay. Next is repetition guidelines. Each technique 5 to 7 repetitions per area, okay. How much repetitions? 5 to 7 repetitions per area, okay. Maintain consistent rhythm, okay. You have to maintain consistent rhythm and avoid rushing, okay. So common mistakes, don't apply deep pressure, okay. Don't slide over skin with oil, okay. Don't move too fast, okay. Don't ignore direction of lymph flow, okay. You should be familiar with all these common mistakes to avoid them, okay. You should be professional to perform manual lymphatic drainage MLD, okay. So clinical key point is these techniques are not massage strokes, okay. They are precise physiological stimulations of the lymphatic system, okay. So summary regarding this: stationary circles, pump and scoop techniques form the foundation of MLD, okay. Each involves gentle rhythmic skin stretching directed toward lymphatic pathways, enabling effective lymph uptake and transport while maintaining safety and physiological accuracy, okay. This is all about this techniques topic, okay.